All right, welcome back to the Cut to the Chase podcast. My name is Nick Pappas. I'm a board certified orthopedic surgeon in New Orleans, Louisiana. If you've listened to the first few episodes, you know how this works. I generally take 3 topics per episode and talk about them for about 2 minutes each. So here we go. All right, first topic. When do I need a joint replacement? So as an orthopedic surgeon, this is something that comes up often. People are wondering, when do I actually pull the trigger and have a joint replacement? So let's talk about the reasons to do it in the first place. So typically we're doing joint replacements if you have osteoarthritis or some form of arthritis that has worn away the ends of the bone where there's cartilage. And if that happens, you start to get a lot of pain and swelling in joints. You try all sorts of conservative measures first, including medications, injections, therapy. But if that fails, at some point you might need a joint replacement, which is where we cut the bone out and then replace it with metal and plastic, essentially. So when do you do that? Well, I tell patients, and I've heard this from other doctors as well, when you start noticing there is a lot of daily activities that it interferes with, you should start considering it. Now, some doctors will even say, do it when it's keeping you up at night, despite you taking medications throughout the day. If you have night pain, if you can't walk more than 100 feet without having discomfort, that's when you should consider it. And I think that's a good message. You don't want to consider it if you've had 2 weeks of knee pain. That's not the time to consider a knee replacement. It's more if you've failed everything, because sometimes little things like injections or therapy can really help your joints out. I've even had patients who were planning to have a knee replacement, and as part of the preoperative conditioning, they were trying to lose a little bit of weight, and they ended up having their symptoms dissipate so much by losing a significant amount of weight that they ended up not wanting to have their knee replaced because the pain was so much less. So those are things to consider. I would only pull the trigger if I had tried everything else first, and I still, despite all my best efforts, it was keeping me up at night. I couldn't walk. I couldn't do my daily activities, and that's when I would do it. That's time. All right, Pilates. People ask me this all the time. Is Pilates enough resistance training for me to protect my bone health, to keep my muscles strong? And here are my thoughts. So Pilates is actually great core strengthening. It does take a lot of strength to do some of the exercises, particularly with the reformer, and you can really keep your muscles nice and toned and put stress across those joints, which is helpful for maintaining bone health. The only issue I see in terms of having it as your sole source of exercise is to really keep bones strong, you generally need to have a little higher impact, at least occasionally, because that's how bones basically work. They need to see a stress to stay strong via a principle called Wolff's Law. So I think Pilates is a great adjunct to doing other forms of resistance training with weights, because it does really keep your muscles toned. The injury rate seems to be less compared to things like CrossFit and other types of activities that are considered more alternative to traditional weightlifting. But I still think doing the traditional weightlifting at least a couple times a week, in addition to the Pilates, would give you the best benefit for your bone health, because you do need to see that stress. If you follow my social media, you know I do favor things like squats if you can do them. If you can't do them, I would train legs by using some sort of resistance, such as leg press, something to really put stress across those bones. A lot of people like doing jumping type exercises. Some people even do things with a weighted vest, but I still think the traditional pushing weights either with your legs or with your arms is helpful for really maintaining that bone density, which basically will decrease with time if you don't continue to stress those bones out. That's time. All right, last topic, topical CBD. So I've talked about it a little bit as an alternative to NSAIDs, but I just wanted to talk about it as what exactly it does and what the difference between hemp and marijuana and what CBD actually is. So CBD stands for cannabidiol, and basically it's a derivative of marijuana, The type that we typically use as an over-the-counter type ointment or even oral supplement is that which contains less than 0.3% THC. If it has more than that, it's considered marijuana. If it has less than that, it's considered hemp. Now, finding the right concentration and mixture has always been an issue. Fortunately, there was a study recently in the journal Hand Surgery that showed that if you apply a CBD that's mixed with shea butter in a certain concentration of 6.2 milligrams per ml, it does really well for pain relief, 60% reduction from arthritis after just 2 weeks. Okay. There are other studies that kind of support that, but that's the best study. It was a randomized controlled trial. The only problem, it only had 18 patients, but still, it was very promising. And as a result of that, I actually had my health education company, Elevated Health, replicate that mixture. And so far, the results have been very good on patients of mine who have tried it, and I've tried it on myself and my family, and they also have found good results. So I do think that will be part of the future. We will study more and more CBD. We'll compare it to other popular topical anti-inflammatories like Voltaren gel. I know there's studies already underway for that, and see what the benefits are of each. But I do think the future is bright for CBD as a way to help mitigate pain, especially when other medications we use do have more side effects typically. But stay tuned for that. Again, more research is needed. But the results that I'm seeing more recently with the CBDs, especially the topical CBD, have been promising. And that's time. All right, so that concludes this episode. Thanks so much for tuning in, and stay tuned for future episodes. Cut to the chase!